How China is caring for its elderly. Baozhen Luo joins us live from Bellingham, Washington. She's a professor of global health at Duke Kunshan University. Thank you so much for joining us, Professor.
Thank you for having me.
Well, we know that China's government has made this issue a priority for quite some time, but what are some of the challenges that remain in implementing some of these programs?
Well, as you said, China really made great strides in providing more financing as well as service infrastructure improvement because the aging population is not only big in sheer size, but also in terms of the pace is really fast. So right now in China, I think still in financing, we know China in the 14th five-year plan, China expanding the long-term care piloting sites from 16 cities from the previous five-year plan to 49 cities. But the challenge still remains that a lot of that funding actually came from the residual remaining funds of the healthcare insurance system. So in other words, China still does not have a standalone social insurance program for long-term care as the sixth pillar of its social insurance sort of a scheme. And another big challenge, I think, it's not just China, many nations facing rapid population aging, including the West, including in other Asian countries, is the shortage of long-term care workforce, shortage for elder care services, because a lot of family caregivers are not able to provide hands-on services. So as a result, a lot of elderly, if they need good long-term care, good elder care, they need to outsource from the market. So the challenge is how can we have very qualified and well-trained professional frontline care workers who are able to handle some of those really complex care needs, such as for those with Alzheimer's diseases. So I think these are the two really major areas that China still need to work a little bit more.
You talked about professional care. Culturally, a lot of families take care of their elderly. Describe some of the struggles and the burdens for the families, especially the kids and even the grandkids.
Yeah, absolutely. I think, of course, it's there's the sandwich generation, right? You have today's long-term care, the family caregivers. They are providing for the old as well as the young. This is the squeeze, right? Does not apply to everybody, but that burden for caregiving is pretty high. And the other is, as I mentioned earlier, a lot of family care, despite they have a lot of the desire to provide the care, they may not necessarily have the hands-on skills, good skills. They are a very good emotional, support source, but comes to really good skilled care, family may just fall short in that regard. So yeah, long-term care challenge is becoming elder care, it become really, really difficult because the complexity of the chronic diseases people have as people, advance into really, really old age.
You touched on this and we're almost out of time, but if I can quickly ask you, almost 20% of the population, as we mentioned, and you talked about growth. How much more is the aging population expected to grow in China?
Well, that pace is going to grow. It's going to speed up even more. And with China's fertility rate, which is not picking up despite the relaxation of the child planning policy. So we're going to see that the rate going to increase until we'll see the baby boomer generation, which is the generation born after 1949. If you add 15 years to that, that generation gradually exit from the society from death. We may see some plateau. But, looking forward to the next 3 decades, the challenge is still quite pressing and needs a lot of effort from all aspects of the society.